Hello, Cameron. My name is Stephanie, and I will be caring for you today. I will be doing your head, your ear, your eye, your nose, and your throat exam. At any point in time of this exam, I want Cameron to tell me if he's uncomfortable or if he has questions, and I will stop and we will reassess everything, and I will answer any questions that you may have. So first, I will be examining Cameron's head for any symmetry. I will also be departing the hair to make sure that there's no lesions, no lice, no trauma to the head. So with Cameron's permission, I will now begin the exam by touching his head. As stated before, I'm going to separate Cameron's hair to make sure that there are no lice, no lesions, no trauma to the scalp. I'm also going to notate the occiput area to make sure that there's no trauma or any indications of any kind back there as well. So next in this exam, I'm going to examine and take notation of Cameron's face, make sure that there's symmetry and there's also no involuntary movement to his face. So again, Cameron, with your permission, I will first touch your what we call the temporal veins here, and there's going to be a pulsation, but we want to make sure that there's no tenderness or of any kind that's there. I will move down to what we call the TMJ, the temporal mandibular joint, and I'm going to ask you, Cameron, if you can open and close your mouth slightly for me. And then close. Okay, perfect. So then next I will be checking for Cameron's sinus pressure. So here, Cameron, I will be putting my hand here and slightly giving a little motion to your sinuses. Do you feel any pressure here?
No.
Okay, how about here?
No.
Okay, so that concludes that part. So next I will be looking at Cameron's eyes. I will be making sure that there's symmetry there. Also be looking at his eyebrows for any type of crusting, even his eyes for any kind of crusting, discoloration, any discharge, any redness, or anything, any type of trauma to the eye. So first I will begin by slightly pulling down Cameron's eyelids for any conjunctiva, looking for any discoloration, looking for any discharge, making sure it's nice and pink, making sure the sclera area is nice and white and not any discoloration like redness or anything like that. So next I will utilize the pen light. Let me turn it on here. Okay. So I'm going to be checking for, I'm going to be looking at glands. Hold your eye, look at me. I'm going to look at the pupils, and I'm going to also check his gland areas on both sides of his eyes. Next, I will step back just a little bit from camera and just check the reflection of both of his eye pupils. From here, look directly at me. Look at the pen light. Okay. All right. And then, so next, I will be checking for Cameron's constriction. Sorry, I'll check the constriction for Cameron's eyes as well to make sure that it's constricting properly. Oops. All right. So when you look into his left eye, and then the reaction will be within the right and vice versa, right? And then it'll be the left. Okay, so next I will be looking at checking Cameron's peripheral view. So Cameron, I'm going to place both hands aside your face, and you let me know when you see my fingers. You're going to say now when you see the fingers on the side.
No.
Okay.
No. No.
Okay, so everything there looks to be okay. So next with Cameron's eyes, I'm gonna check. I'm gonna also check his ocular views. So Cameron, you follow my finger, but do not move your head. Okay. Okay, so that concludes the head, the face, and the eye exam. Please hold. So we're going to move on, and next we're going to do the fundoscopic exam. So I'm going to utilize my I cannot see. So Cameron, are you okay? Any questions? So the next part of the exam, we're going to do the fundoscopic exam, and I'm going to use the ophthalmoscope, and we're going to examine your eyes. So I'm going to stand far back from just far, and we're going to examine your eyes. Can you open your eyes, sit straight? And you're going to look directly at me. So I'm at this time looking at Cameron's veins. Also, I'm looking for the optic disc in his eyes. And I'm going to do both eyes. If I'm looking in the right eye, I will use my right eye. For the left, then I will use the left. So the next part of the exam. So moving along in the exam, we're going to go ahead with Cameron's ears. So first, we're going to make sure we look at each ear just to take a visual view of any discharge, any trauma, any discoloration to the ear. Also, we're going to make sure that we do a little tug on Cameron's ear to make sure that there's no pain or anything before we go along with the exam and use the otoscope in his ear. Before doing that, I'm going to do a little test on Cameron to make sure that his hearing is intact. We can either have the patient to hold the ear, or either we can do it for them, and we'll whisper something in their ear and ask them to repeat what was said. So here I'm going to hold down your ear, and I'm going to say to Cameron,
green light. Hot dogs.
Okay, so his hearing is intact. So next I'm going to examine Cameron's ear by looking at his tympanic membrane. So I'm looking for, again, for any discharge, any bulging, and any discoloration to the ear. So by doing so, I will begin by pulling Cameron's ear, because he's pediatric, so he will be down and back. So I'm going to slightly place my hand here so that this doesn't push too far into Cameron's ear. Okay, so no discoloration, no bulging, no discharge noted. And I will also do the same thing with this ear. Again, he's pediatric, so it will be a down and back gesture. Put your head to the side for me, Cameron. To the side. Okay. So with that, so next we will continue on with the hearing test, and we will be utilizing the tuning fork for the Weber and the Renz test. So first, I will this is to test the conduction of Cameron's hearing, and I will do so by striking this tuning fork and placing it either on the top or either right here in front in his forehead. And Cameron, you will tell me which ear, or if you hear it in both ears.
Both.
Okay. So next we will do the Renz test, where I will place the tuning fork after I strike it behind Cameron's ear, and he will tell me if he hears the vibration, or when it's. Did you hear it?
Yeah.
Okay. Oh, I think I stopped it. Oh, I'm hearing it hard. You hear it?
Yeah.
You don't hear that? You don't feel the vibration?
Yes.
Okay. Hear it?
Yes.
Okay. So also, I want to notate with the tuning fork that the air conduction is greater than the bone conduction. And with the tuning fork, Cameron will be able to tell me once it starts, the vibration of the tuning fork starts to fade away in each area. So next we're gonna inspect his nose. We're going to assess. First, we're going to assess on the outside to make sure that it's symmetric. There's no trauma to the nose or any discharge or anything like that that's on the outside. So slightly we will utilize the light again. We will slightly tilt camera's head back, just give his nostrils just a bit of a push. And when we be looking inside, we're looking for the turbulence. We're looking for the nice pinkish color, no discoloration, no inflammation there. We will make sure to look in both for the same thing, looking at the symmetry, looking at turbulence, make sure that there's no discharge, there's no redness, no inflammation or swelling as well. So next in the examination, we will be examining Cameron's mouth area. So Cameron, first I will look outside of his lips, make sure that there's no scab areas, no sores, no discoloration to his lips. And then I will ask him to open his mouth for me, say ah.
Ah.
So then with that, I will utilize the light again as well. And then I will look into Cameron's mouth, and I'm looking at the palate, making sure that there's no lesions or any sore, any red areas. I'm looking at his tonsils, making sure that it's intact. I'm looking at his mucosas, making sure that there's no discoloration, there's no drainage, there's no lesions or sores in the mouth. Can you lick your tongue out? Looking at his tongue all the way out, looking at his tongue for symmetry, making sure there's nothing on the tongue. Also, I'll ask him to lift his tongue, lift it up. I'll look up under the tongue as well to make sure that everything, the mucosa is moist. There's no type of indications of trauma to the mouth. I'm also looking at his teeth to make sure that there's no cavities or any infections or anything of that sort in the mouth as well. So that completes the head, the ear, the eyes, the nose, and the throat exam. And next I will be moving on to the cardiac. So next we will begin the cardiac exam. So Cameron is not lying down. I don't have a bed or someone to do this for us. So we're going to imagine that Cameron is lying down, and I'm going to have Cameron to tilt his head slightly to the left, and we're going to be looking for the jugular vein, and most of the time it's not as apparent, but if it is, you will be able to palpate it here, and it will have pulsations. So then we will be looking for his carotid artery. So we will palpate for that. And we want to do it only on one side at a time, because we don't want to do it at the same time, because it will be an endangerment to Cameron and can cause some issues with Cameron's brain. So then we're going to do this side. Okay, and then that's felt. So then now we're going to move along, and we're going to have Cameron to sit back since he can't lie back, and we're going to inspect the chest, make sure this is symmetric, make sure there's nothing that looks uneven as far as his breathing or his effort to breathe. So I'm going to start by palpating over near the apical area. You can see Cameron. Near the apical area for Cameron on this side of his chest. And then we're going to move over to the second intercostal space. Down from there to the third. About the third. And then we'll move down to the fourth. And then we'll move over then to about the fifth. So after we palpate it, what we're looking for is any bulging or any feelings of pulsations or any abnormality in the heartbeat. So now over near the mitral valve, we'll also try to notice the maximum impulse. The point of maximum impulse, and if you can't feel it, you can have the patient to, if Cameron was lying down, he could lie to his left side, and I will be able to listen this way, and most of the time you can hear it better that way. So from that point, and if you couldn't see me before, I'll do it over. I had Cameron to tilt his head to the left to see if we could see the jugular vein or any pulsations there. And in most cases, you cannot just visually see it. And then I slightly kind of palpated for his carotid artery here. And then also on this side, one at a time. So next I will be auscultating each of those areas. So first, I will auscultate his right carotid. I'm looking for a nice brewy sound in which I hear. Then I will flip my stethoscope over and also do it with the bell. Okay, and then I'm gonna do the same thing on the other side. Turn it over. Okay, so then for each point, I'm gonna also do this again. I'm gonna first start over to the right chest of Cameron, and I'm gonna listen. I'm listening for that lub-dub sound. And then I'm gonna move over to the second intercostal space. There it is, the lub-dub. We're gonna move down to the third and the fourth. And then over to the fifth. There's no skip in heartbeats. There's no galloping or any type of murmurs heard. And as I noted before, if you can't hear the point of maximum impulse, you can have him to lean over if he was lying down. Okay, and then so that would complete that part. So also you could have Cameron sometimes from the murmur. Sometimes you can hear it if a person slightly lean over. So you will have them to kind of bend over, and you will listen to each area the same way. In each area, you want to go the second, third, fourth, and then over to the fifth intercostal space. And I would go back, sit back camera. Also, I would do it with the bell side as well. And again, we're listening for the heart sound. We're looking for the S1, S2, and also making sure that there's no murmurs or any galloping or any other heart sounds that that are abnormal. Okay, so now we will begin the neurological assessment portion. So we're having to maneuver here so that we can get all parts correct. So first, with the neuro, we would test the olfactory, which will be smell. And generally, what you would do is have the patient to occlude one side of the nose with their eyes closed and have them to smell something and see if they can identify the smell. Something like cinnamon or a mint flavor or something of that sort to make sure that their smell is intact. The next part of the exam will be the cranial nerve number 2, which will be optic, which would be for me to look into the patient's eye. And so with that, I will be looking into this way, Cameron. I will be looking into Cameron's eye, looking for the optic disc, looking at the blood vessels, and those sorts of things when checking for cranial nerve number 2. Also, I will be looking for cranial nerve number 3 would be the test for pupil constriction. So with pupil constriction, I will have to change my light here. And what I will be doing is I will be shining the light to the left of the eye, but looking for the right constriction in the eye, and also noting the pupils. For 4 and 6, I will be looking for, this is the trochlear nerve, and to test that, what I will be doing is also checking Cameron's peripheral vision. So by doing that, I would do the H is what I call it. So checking his peripheral view. So Cameron, follow my fingers only, but do not move your head. So you will go that way, give it a lateral move, back up to the middle, other side. Same thing here, checking camera's peripheral. Next, we will do trigeminal, which is the motor function. And so what we would do is have camera to tighten down on your jaw, bite on your jaw, like that. And that will be testing his trigeminal. The next thing we will be doing is, so continuing on with the trigeminal, we've tested the motor function of it. Now when we do the sensory, I don't have a Q-tip, but normally we will take a Q-tip or either a foxtail and we can break it and utilize it as dull and sharp. So I will have Cameron to close his eyes, and Cameron, you will tell me if it's dull or if it's sharp.
Dull. Sharp. Dull. Dull. Sharp.
Okay. So next will be number 7. We will test Cameron's facial expressions, while we will have Cameron to smile, frown. Can you frown? Come on, frown. Okay. And you have you puff out your cheeks. Okay. So next will be cranial nerve number 8, which is acoustic, and that tests his hearing. So far in this assessment, I can note myself that Cameron has been able to hear me without me repeating myself too many times. But I can also do the whispering test on Cameron again and occlude one ear.
Hot dog.
Also, I can do the Weber's test again on Cameron, where we can test the conduction of his hearing. One or both? Which ear?
Both.
Okay. And also I can do the Rhines test, where he can tell me when it stops.
It stops.
Okay. And also I would have tell me when it stops. It's still going?
It stops.
Okay. So that is the acoustic. Number 9 and 10 will be the glossal and the vagus nerve, which will test Cameron's swallow. So swallow for me, Cameron. Do it again. Okay. And then that also it would be for me to ask Cameron to open his mouth. I will be looking at the uvula, making sure everything is intact. I will have him to stick out his tongue, making sure there's no deviations to it, making sure the uvula is midline and everything of that nature. So next, we will be doing the accessory test, which is cranial nerve number 11. And that will be shrugging his shoulders. So I'm going to ask you to sit straight up for me. So I want you to shrug your shoulders, both at the same time. Do it again. Okay. So then I'm going to ask you to bring your neck this way toward my hand. Don't let me push it. Okay. The other way. Okay. So then with number 12 will be the hypoglossal, which will be sticking out your tongue, making sure there's no deviation and that the tongue is in alignment and everything is normal there. So that concludes the cranial nerves. So next we'll be doing the motor function, and we will be looking at his gait, the stance, his posture, making sure there's no involuntary muscle movement, no ticking, no twitching, or anything of that nature. Then we'll be looking at his muscles, making sure there's no atrophy to his muscle tone, that everything looks to be symmetry and intact. So in order to do that, we will have Cameron to bend his arm. Hold your arm out, Cameron. And then I want you to just checking his muscle tone, making sure his muscle tone is intact and there's no issue. Because if he was contracted, I wouldn't be able to, bring his arms up. Or if he had the Huntington disease or the Parkinson, it'll be just a little harder for me to bend his arms. Also, we will test for the muscles in his hands. So I want you to hold your hands out. He's going to hold it so they can see him in the camera. It's no good if they don't get it. Okay, so we're checking. We're going to ask you to hold your fingers out like this. And so don't let me push them in. Don't let me push them. Don't let me push them. Okay, so that's okay. And then so next we would check for the muscle tone in his hands. Those were his fingers. So now I'm going to do the hands. So ball your face. Hold them straight up, Cameron. So don't let me push you down. Don't let me push you up. Okay. So then next we will do your shoulders. So push your shoulders up. Don't let me push you down. Okay. So then with all of that, we're checking for the flexion, the extension, the abduction, the adduction of everything. Next will be his legs, if I can get them. So we'll be checking for his legs. We'll make sure we look for symmetry, that the calves and the tones, we'll be looking at that. So Cameron, I want you to hold your legs out. So push against my hand. Push against. All right. So then I'm going to try to push. Don't let me push you back. So I'm going to try to push you. Don't let me push you. Go the other way. I'm pushing his legs. It's hard for the camera to view. Pushing his legs. Okay. So then next we're going to test for the abduction and adduction of his hips. So we're going to have Cameron to lie on the sofa. You can lie down, Cameron. See if we can get this camera on him appropriately. I think I got it. Okay. So with his legs, what we're going to do, we're going to test for the flexion and extensions of his legs and also abduction and adduction. So bend this leg up. So I'm going to push. Don't let me push down. Don't let me push down. Don't let me push up. Same thing over here. You're going to bend this leg. Don't let me push down. Don't let me push up. Okay. So then you're going to push that way. So you're going to hold this leg and you're going to push that way. Don't let me push too far. Okay. Don't let me push too far that way. Same leg. Inward. Outward. Okay. So that's testing his internal, external rotations of his hips. So then next we're going to do the coordination test, which is the Romberg test. Stand up for me. Try to get this camera. Can you stand up? Okay. Ooh, this is hard. All right. So Cameron, we're going to have you to close your eyes and we're going to have you to hold your hands out. Hold your hands, palms up. Okay. Straight out, straight out. We're going to have him to do that for 1 or 2 minutes to make sure that it doesn't drop. Okay. So then we're going to have you to do the same thing. Eyes closed, hands down. And I'm going to, and we saw Cameron hands came back up on its own. So that's testing his pronator drifts. And now we're going to have Cameron to walk. If I can get this camera to do right. Just a moment here. Whew, Lord, all right, Cameron. So we're going to have Cameron to walk in a straight path. Come on, Cameron. Just walk. Okay. So turn around. And then next you're going to walk like this with your feet like in the front, one in front of the other. No. Okay. So now I'm going to ask you to walk on your heels over that way. Yep, just heels. On your heels. On your heels. Okay. Now walk on your tiptoes. Tiptoes, camera, tiptoes. Okay. So that's the walk. We're gonna make watching his gait and looking at his balance, and those are the things we're checking. So then next we're gonna ask Cameron to sit back down. Cameron is sleepy. It's 2 in the morning. Okay, so next, Cameron, I'm gonna check your coordination again by having you to slap your hands like this on your leg. Do it fast you can. Fast. Okay, so we noticed that Cameron was able to do that without any issues. So then, lastly, we're gonna also check Cameron's visual field. Cameron, I'm gonna have you to take your finger and touch mine and then point to your nose. So you're gonna do this and then you're gonna do this. So bring your finger, touch, and then you're gonna touch your nose. Nose. Touch my finger. Go back, touch your nose. Touch my finger, touch your nose. Touch my finger, touch your nose. Okay, perfect. So then next, we are going to do, I think it's called the Stragness test. I'm gonna have you to close your eyes. Okay, and then I'm going to place something in Cameron's hand, and I'm gonna close your eyes. I'm gonna ask Cameron to identify the object. Hold your hands out. Close your hands. What is that? Correct. So Cameron was able to identify this pen. So lastly, we're going to test his reflexes. And by testing his reflexes, we're going to start with his bicep. So Cameron, hold your arm out. So I'm going to test his bicep. Bend your arm just a little bit. Just a little bit. Bend it just a little bit. Okay, so he kind of twitched just a little. So next we're going to do the tricep. You want to bend it here. Okay, that's testing his tricep. So next we're going to do the patella, which is also known to be the knee. And bring it back up, Cameron. So with the knee, there is an indentation that's about, we'll do this one, Cameron. Okay, we're going to do both. Hold it back. So indentation, that's about here. Oh, you have a long knee. Hold it back up. Gotta find it. Do you feel it? So normally you'll feel like a little twitch. The patient will kind of jump a little bit. Cameron here has like a little bone structure. He's been told by the doctor that it's from people that are tall. So it's kind of hard to find Cameron's indentation here on this knee. Let's see if we can get this one. Okay. Alrighty. So that was the bicep, the tricep, and also his knees. And next we're going to do his Achilles. So we're going to reach back here. That was easy. So that one was easier to find. So that concludes my head, my ear, my eyes, nose, throat, my cardiac, and also my neurological exam. Hopefully I touched every point. Thank you.